We are extremely excited, would be an understatement, but very, very delighted to announce the global release of the People's Report Card on the US health system. This is our next session. What do we mean by the People's Report Card? What is this People's Report Card? Well, it is the latest data from the People's Voice Survey of the United States, in which we oversampled the state of Missouri, and in which we also piloted a brand new module on mental health, a crisis, a challenge that you've already been hearing about in this meeting. The People's Voice Survey will tell us how people use and experience the health system. And some of the key questions we will discuss on this panel are very simple. Is the health system working for people? How do people rate their health system? And how has the perception of the public changed, and this is a key question, over the past several years, because this is our second wave of the People's Voice Survey in the US. Because this is an international meeting, a global meeting in which comparison is one of the central themes, we want to know, how do people in the United States and in Missouri compare to their peers around the world? So we'll have panelists speaking to that. And finally, we will discuss the research implications. How can data like the People's Voice Survey data help us guide improvement? How do they help us speak to policymakers, speak to politicians, speak to health system leaders to guide improvement? We have an esteemed panel today to help us parse these data, and I'd like to introduce them to you now. To my right and your left is Dr. Todd Lewis. Dr. Lewis is assistant professor in the WashU School of Medicine. He's a research lead with the Quest Network and is the lead researcher on the People's Voice Survey. Dr. Lewis studies how health systems are perceived by populations and the effectiveness of primary care. Next to him is Dr. Sandro Galea, Dean Sandro Galea, the Margaret C. Ryan, Dean of the School of Public Health, the Eugene S. and Constance Kahn, Distinguished Professor in Public Health in the Washington University School of Public Health. Dr. Galea is the inaugural dean of the Washington University's new School of Public Health, the first new school at this university in 100 years. A population health scientist and physician, and a member of the National Academy of Medicine, Dr. Galea is a prolific writer, author, and speaker. And here I should point out that the School of Public Health is a partner, a co-investor in our People's Voice Survey, contributing funds and expertise and analysis to expanding this survey throughout the United States, and in particular in Missouri. And next to him is Ms. Spring Schmidt. Ms. Schmidt is the CEO and president of the WashU Public Health Institute, a nonprofit organization that works to transform the state's public health system. Ms. Spring also holds an appointment at the St. Louis University College of Public Health and Social Justice. Next to her is Dr. Timothy McBride, the Bernard Becker Professor in the WashU School of Public Health. Dr. McBride co-directs the Center for Advancing Health Services Policy and Economics Research, CASPER. He's a health economist who studies health insurance, health reform, rural healthcare, Medicaid and Medicare policy, health economics, and access to care, with a focus on Missouri and rural populations throughout the United States. And finally, Dr. Chike Nwangwu, the Chief Executive Officer of NOI Polls, a preeminent Nigerian public polling and research organization that works very closely with the Minister of Health and with our close colleague and my former co-chair of the Lancet Commission on High Quality Health Systems, Dr. Mohamed Pate. Dr. Nwangwu is a medical doctor who also has a DrPH degree from Johns Hopkins University, and he's an expert in data and evidence collection. But another reason he's on this panel is he's worked extensively in the translation of those data for policy. So as you can see, we have a terrific group to help us interpret and comment on the findings of the People's Voice Survey. So let me start by describing just a little bit what is the People's Voice Survey and the People's Report Card. And for this, I want to bring you back to 2018, when a group of us, about 40 academics and policy practitioners, published a report called the Lancet Global Health Commission on High Quality Health Systems. And in that commission, we started with the premise that health systems are first for and about people, and that a high quality health system in any context needs to do three things right. Thing one, It needs to consistently deliver care that improves and maintains health, not just sometimes for some people and in some towns. Second, it needs to generate a sense of value and trust from the population, because without that value and trust, services will not be used, health systems will not be funded. And three, any high-quality health system needs to show the ability to change, the ability to respond to changing population health needs, changing preferences, changing opportunities, as we've been hearing about this morning. And so when we looked at the evidence around the performance of health systems and what needs to be measured, the Commission concluded that health systems should measure and report what matters most to people. And what is it that matters most to people? I would suggest it's not doctors per capita or even the operating margins of the BJC health system. That's not what matters to people. It certainly matters to Dr. Lynch and many, many others, right? What matters to people is whether the care that they get in the clinic, primary care, hospital, anywhere, is competent. That's what matters to them. And whether when they leave that clinic, somebody will be able to follow their journey and follow up and know what the results mean for their condition. They care a lot about user experience. How are they treated in the clinic? Are they made to wait indefinitely? Are they treated with respect? Are they dismissed? They certainly care about health outcomes. That's the first reason that they come to healthcare. Nobody chooses. I always remind my colleagues in the systems research world, people don't choose to just sit in clinics. I know we see utilization high, but it's because they have a need. They're not going there for a haircut. They want better health. And then lastly, we need to be measuring confidence in the health system, because this is a leading indicator. Why is it then, where we're interested in the economics of our society, we measure consumer sentiment, and companies use that information to plan their investments? Because they can see that people are not going to buy the refrigerator if they're not feeling confident in the economy. Well, the same thing applies to healthcare. We need to understand confidence today to be able to adjust how we communicate and the services we provide for tomorrow. So confidence is a key leading indicator of the population's willingness to work with us on improving their healthcare. And so when we looked at what data systems and measurement approaches are out there in the world, that's the first step of any good research question, is what shouldn't I be doing, because it's already there. We identified that there was a huge gap in this question: how would the health systems work for actual people? There's tons of EMR data telling us how clinical symptoms are changing, perhaps. We have a lot of data on the infrastructure of the health system, financing, health workforce, et cetera. But really, how are health systems working for individuals? So what's our approach? What we are doing in the People's Voice survey is trying to promote accountability of health systems. This survey, we get a lot of requests for the use of the survey, and some of them come from a sense that they can give you very detailed data on one facility or another, like our CAPS surveys here in the US. This is not that. The People's Voice survey is intending to provide a global view of the public sentiment and use of the health system, to inform improvement, to track change, and to promote accountability. The way that we typically do this is either through telephone or online sampling, or in-person sampling, depending on the country, because what you need to know is that the People's Voice survey is really the first truly international survey that can be adapted to any health system at any income level. Now, this is not a trivial adaptation, because obviously survey has to make sense in each setting, but it can be done. And indeed, we have implemented the survey in 22 countries to date. And specifically, we are here to talk about the most recent results for the United States. We had a first wave of the People's Voice survey in the US in 2023 with 1,500 respondents, and you will see some of their data today, because we will be comparing where we've come in the last 2 years. The most recent wave, which closed data collection just a month or two ago, was completed in late or mid-2025 and had this oversample. So we had, first of all, a large survey with 4,000 respondents using a probability online panel, as well as random digit dial, to oversample residents of Missouri, because you will not be surprised that in nationally comprised online panels, there are not enough people in Missouri to be able to sample them. So we have to go find them, okay? This is just a quick map to show you that the survey has not only been done, but has been done successfully and interpreted and applied around the world at all income levels. And this may look a bit like the map of this meeting, right? There are people from many of the countries here today with us. And then I want to just close by saying, what is this survey for? We love the survey. We love data sets, especially comparable data sets. And by the time Todd and the team are finished standardizing these variables and putting them in the public domain, they're already being used to fuel PhD theses, master's reports, and many, many papers. We want that because we're trying to build the science of health system quality. But really what we deeply want, and this is where we need all of your help, is we want policy impact. We want impact from these data. We want systems to change on the basis of these data. And so what you see in front of you are some just quick glimpses of the way that People's Voice survey data have been used in policy dialogues here on the right with the Ministry of Health in Peru, as inputs to medium-term strategic frameworks, for example, in the country of Ethiopia, and in discussions about health system direction in Nigeria. So we'll hear more about that from Dr. Chike, who's here. And it is this use case, these use cases of People's Voice survey that I hope we'll get to on this panel, as well as what the data are showing us and telling us. Because ultimately the survey lives and dies by the impact it makes. We're academics, we love the data, but we're happy to shift gears if this isn't making a difference. All right, so with that, I would like to introduce Dr. Lewis, reintroduce Dr. Lewis to give us the findings of the People's Report Card in the United States. Welcome, Todd.
Thank you. Perfect. Great, so I want to start by giving you a sense of the guiding questions for my presentation for the next 20 minutes. We have a lot of data on the US health system. I can't show you all of it, but I am going to show a lot of it. If you work with our team for even a day, you will know we really like data. So our first question is, how do Americans rate the US healthcare system in 2025? Okay, that's our central question. Second, how does Missouri compare to the national average? Third, in one particular area, mental health, a key area under-researched in this country, how are people using care for mental health in this country, and what do they think about it? And finally, this is the People's Report Card. I promise you, you will leave today with some grades. I want to start with a picture of utilization in America. On average, people report they're having 7 contacts with the health system per year. Those on average are 6 in-person visits and 1 telehealth visit. 7% of our respondents used no health care at all, and 40% were frequent flyers, over 4 contacts. And not on the slide, I can tell you that people on average used 3 different health facilities in the past 12 months. So people are shopping around, seeing multiple different providers, et cetera, not only going to one place. Oh, and I should say, key point here, we are among the highest utilizers in the world, as per our 22-country sample. Americans are high utilizers of healthcare. I think we are tied with Germany and Uruguay in our sample, which are right about at 7 visits on average as well. Now, what is it that the health system's actually providing? What is the health system doing? Now, if I pulled one of you at a coffee break and asked what the health system's key function is, you might say it's curing, it's curative care, it's treatment. But what we see when we ask people, what was your most recent visit in the healthcare system for? 46% of people say it was for prevention or for a checkup. So a big part of what the health system is doing is not only curative care, but preventive care. 27%, just over a quarter, said their visit was for chronic illness care or follow-up for an existing condition. And just under a quarter said this was for urgent care or a brand new problem. So a lot of what the health system is doing is detecting and preventing disease. Now, when we zoom out and don't look just at users, but what kind of preventive screenings are people getting in the whole population? We see these are all have the denominator that matches US guidelines. So they're among adults 18 plus, but some are just for women, some are for certain age groups. 84% of Americans had a blood pressure check in the past 12 months. Only 42% of women 18 to 65 had a cervical cancer screen in the past year. Now, I don't know if you can tell, mammogram is highlighted here in this dark green. Is that showing up for all of you? Okay, great, thank you. The reason this is highlighted, 65% of women 40 plus in 2025 said they had a mammogram in the past year. This was a 12 percentage point increase from when we first did the survey in 2023. And so what I think is happening here is this is a catch up from a backlog of preventive screenings during the pandemic. Now, let's look at telehealth a little bit, especially given the shift to telehealth during the years of the pandemic. On average, as I said, Americans have one visit per year, one digital virtual visit per year, which is pretty steady since 2023. So any uptick we saw in telehealth utilization seems to be here to stay. The highest rate of telehealth usage out of the countries in our sample is in the United States, except for the UK, which is just slightly higher. And the predominant use of telehealth, in contrast to in-person care, which was largely preventive, was for chronic care and follow-up for existing illnesses. But we see a distribution here. We see care for chronic illness, but we also see about a quarter of people using telehealth for new problems, for urgent problems, and also for prevention or for annual checkups. Now, interestingly, 72% of respondents who use telehealth said that their care was very good or excellent. So I'm going to refer to this throughout my presentation as rated care highly. Basically, they were endorsers of the quality of their telehealth visit. And you will see that this is almost as high as ratings for the quality of your own in-person care. We have the highest approval out of all 22 countries in our sample on telehealth here in the United States. So Americans are quite happy with the visits that they're getting virtually. Now, some of those figures are good news for the healthcare system. I'm going to talk about some of the struggles. 1 in 6 Americans did not get care that they needed. We asked people, was there a time when you had a need for care, when you were sick, and you did not get care? About 15% of people said, yes, there was a time I didn't get care. This is pretty steady since 2023, but we see the main drivers as cost of care. 38% of the reason they did not get care when they needed it was due to cost. This is national. And the second reason was patient experience, which is a composite of several factors: wait time, respect in the visit. That was 26% of respondents. And I can tell you, in terms of the proportion of people reporting different reasons for their unmet need for care, these two are increasing over the last 2 years in the United States. We also measured financial strain in the People's Voice survey with 2 measures. One is, did people have to borrow money from friends, family members, money lenders, other sources to pay for care in the last year? And the second was whether they had to sell assets, something like furniture or jewelry, to be able to afford care. 1 in 6 Americans faced this sort of financial strain. And I can tell you that about 5% faced both kinds in the past year. So an area of concern for the US health system. Now, one bright spot, I promise there are bright spots as well. Americans rate their own care very highly. Americans really like their own doctors, their own clinics. So about 78%, 8 in 10 Americans rated their most recent in-person visit as very good or excellent. They rated that care highly. You can see among high-income countries in our People's Voice survey sample, the US is #1 in rating people's own care. Now, I want to be realistic about this. We pay a lot for that rating. Greece and the UK spend much less on health than the United States, but they're not that much farther behind in the ratings. So it's important to contextualize these ratings as well. But Americans, very happy with their own care. However, let's zoom out a little bit. So instead of looking just at people's own care, let's look at care available in the community. You could think of this as care available to you, your neighbor, to people in your town, your village. When we look at different service areas, about 60%, 6 in 10 people, give high ratings to the service areas on the top of the slide: care for women, maternal care, care for children, and chronic disease care. These are lower ratings than people gave for their own care, their own last visit. Mental health was an area where Americans were particularly critical. 4 in 10 gave a high rating to mental health care, much lower than we saw for the other service areas for care available in your community. And let's zoom out even further. So now we're looking at national ratings of care quality, particularly for services covered by private insurance versus services covered by Medicaid. And for those not familiar, you can think of Medicaid as essentially a social safety net insurer for low-income Americans. And we see a huge gap in perception of the quality of these services by insurance status, almost a 20 percentage point difference. 54% of Americans saying the quality of care for people with private insurance is very good, versus only 35% for people who have Medicaid. Now, I want to zoom out even further and talk about confidence and endorsement of the health system a little bit. This is another bright spot for the United States. We do okay here. 2 in 3 Americans are confident they can, 2 things, get good quality care if they were sick tomorrow and afford that care. This we call our measure of health security. This is personal health security. You know the health system is going to be there for you when you need it. You can also think of it as an indicator for universal health coverage. So 63% of Americans were health secure. They said they could get and afford care if they were to need it tomorrow. We're 3rd among high-income countries in our sample on this measure, but it's increasing. 5 percentage point increase since 2023, a statistically significant increase. There's a little bit of a bump in confidence among Americans. Now, where we see growing concern is about the direction the health system is heading. So, confidence, 2/3 of Americans are confident that they can get and afford care. But when we asked, do you think the health system is getting better, staying the same, or getting worse? Here's where we see more cause for concern. 88%, almost 9 in 10 people, said the US healthcare system is either staying the same or it's worsening. So we're seeing deep concern. Even if I feel like I can get care today, I can afford care today, it's a bit of a view that we're standing at a precipice. And there's concern about what's going to happen in the near future. Not pictured on the slide, we also ask, do you think that the health system is working well as currently structured, or do you think it needs some sort of overhaul? 8 in 10 Americans said that they think the health system needs a major reform or to be completely rebuilt. The last thing I'll say about the national perspective is something about healthcare leadership in the United States. We ask whether you think that healthcare leadership in this country takes your opinion into account when making decisions. 1 in 3, only a third, thinks that the US government takes their opinion into account when making decisions about their healthcare. We also asked about pandemic management, how well the country managed COVID-19, the COVID-19 pandemic in the United States, and even fewer, 1 in 5, thought that the United States did a good job managing the pandemic. So what we're seeing is persistent frustration. I can tell you that these numbers actually declined since 2023. So ongoing, persistent, and perhaps increasing frustration with health leadership in the United States. Okay, now we are in Missouri. This is my new home and the home of WashU. I want to give you a sense of what we learned from this oversample of Missouri. There we go. So on average, we see worse self-rated health and worse self-rated mental health among Missourians compared to the US average respondents. We also see more chronic illness, so overall a sicker population in the state compared to the country. However, from the measures we have in the People's Voice survey that let us measure activation, that we use to capture activation, we actually see that Missouri respondents are more activated than the national population. In terms of utilization, quality, and costs, just a short summary. Now, this was surprising to me. We actually did not in our survey see deficits in utilization of care in Missouri compared to the country. More Missourians had a usual source of care, a place they knew they could go in the health system when they needed care, 90% in Missouri versus 83% nationally. We saw similar rates of health contacts, as I talked about in the very beginning of my talk, and similar rates of preventive care, actually, across the screenings that I mentioned earlier. Quality ratings for people's own care were also similar to the national view. However, the area where we see the biggest deficits in Missouri are on unmet need, which was 17% in this state versus 15% nationally. And the key reason that Missourians gave when they had unmet need was issues with patient experience. And finally, financial strain. 20% of Missourians reported financial strain having to borrow money or sell assets to pay for care, compared to 15% nationally. What about confidence? How confident are Missourians in the health system? Fewer had personal health security, that they were confident that they could get and afford care, 57%. More said they thought the health system was getting worse compared to the national average. More said that they thought the health system needed to be completely rebuilt. There needed to be some overhaul of the American health system. And they were very critical of leadership. Only 11% in Missouri compared to 20% nationally approved of the way the COVID-19 pandemic was managed. And only 25% thought the government was taking their opinion into account. I want to zoom in on one topic where we also focused in this 2025 People's Voice Survey in the US, mental health. I want to give you a little bit of a picture of how mental health care is being delivered in this country today. We included the patient health questionnaire, PHQ-2, in the survey. And we found that 18% of respondents screened positive for possible depression. Among those, 53%, just over half, of people with possible depression saw a mental health provider of some kind. And about 2/3 said using that care, that helped somewhat or a lot, rather than not helping very much or not at all. Now let's look at the patterns of use. The modal pattern is some combination of a mental health provider and a form of self-care. That's 47% of the respondents with possible depression who are using both strategies, some sort of provider and their own strategies. Notably, only 30% have no care at all. They're not seeing a mental health provider, nor are they using any strategies on their own to address their mental health. And 17% were using self-care strategies only. Now, who are these mental health providers? Where are people going? The number one place that people are going is to their GP, their general practitioner or a family doctor. According to respondents in our survey, that is the most common source of mental health care for respondents with possible depression. You see, after that, we have mental health specialists like psychiatrists and psychologists. At the very bottom, that long bar, that 53%, this is people who are using multiple mental health care providers, more than one of the people on this list. And I mentioned self-care strategies. What's the ecosystem of self-care strategies that people are using to manage their mental health? This is again among people with possible depression. The number one thing, 28%, is exercise. We also see meditation and mindfulness rise to the top, and then an array of digital approaches, which really pop here. Discussion forums and online social networks, apps, informational websites, etc. This is where people are largely going for their mental health care when they want to address it themselves. And 2/3 were using more than one of these strategies. Okay, I promised a report card. On the left, we have our grade scale. You can see that we took a conservative approach. We are very generous graders. An A is an 80% and above. I don't think my mom would have stood for that, but that was our threshold here. 70% to 79 is a B. C was 60 to 69% in terms of absolute values, absolute performance on the 15 indicators I'm about to show you, and so on. We also ranked performance of the US against the 6 other high-income countries, the countries that spend a lot on healthcare, to compare them to the US, okay? Let's start. Let's start with receipt of preventive care. This is an average of the proportion of people receiving each of the screenings I mentioned earlier compared to national guidelines in the US. We get a C, sort of mediocre on preventive screenings. That said, despite this middling performance in an absolute scale, we are number 2 among countries on preventive screenings. So no one doing all that great. We're number 2 after Italy, which does really well on preventive screenings at a population level. Barriers to care. So this is, again, unmet need for care and financial strain, but they're inverted here, so they go in the positive direction. So you've avoided an unmet need for care. You've avoided financial strain. Now, in absolute terms, we get an A on both of these measures in the United States because they surpass 80% who avoided these issues. But we're at the bottom of the barrel in terms of the 7 countries that we are including in this comparison. Number 6 on unmet need avoided, only the UK is lower than the United States. And we are number 3, which doesn't sound so bad, but we're 3 of 3 on financial strain, after Germany and Uruguay, where we also measured this indicator. Quality of recent care. As I said, this is a bright spot for the United States. We get Bs. I'm happy with Bs. It's not terrible. On quality of telehealth visit and quality of your own in-person care. And while we only get a B, we don't reach an A, we are number 1 among these countries on people's ratings of their own care on both of them. Now, zooming out, care available in your community for the service areas that I mentioned earlier, care for women, care for children, chronic illness care, and mental health care. This is where we start to see some pain points. 2 Cs, a D for chronic disease care, and our first failing grade, an F for mental health care in this country. Now, unfortunately, we are number 1 on all of these. which tells me that while the US is struggling, we are struggling among a set of countries that are also struggling with these same problems. Let's look at quality of care in the country overall. I mentioned this gap between the perception of services covered by private insurance versus Medicaid. Here we do much better than on the services I just mentioned. A for privately covered services, but a gap to Medicaid, a B for Medicaid services. We're number 2 on the perception of private care in this country, privately insured, private covered services. And when we compare to private systems in other countries, which is a slightly different function, but when we compare, we are just after the UK. And finally, confidence. Another area of concern for the US. We are middling on health security, a C, and we are number 3 among countries on that indicator. We have a D on the direction of travel for the health system, okay? The proportion of people thinking the health system is getting better is quite low. And we are number 5 among 7 on that measure. And finally, our 2 measures of healthcare leadership, approval of pandemic management, and whether the government takes your opinion into account, are 2 more failing grades for the United States. We are number 4 on the government taking your opinion into account, and we are last place in terms of people's approval of how the pandemic was managed in this country. So, I hope I whet your appetite for learning more about these data. I'm very excited to announce the launch of the People's Voice Survey dashboard for the US. This has been a labor of love for several people in our team and at this university to get this dashboard up and running. You can scan the QR code on the slide or follow the web link at the bottom to check it out. It should be live right now. You can go on and you can look at these indicators and you can explore across the US, look at Missouri, look at different regions of the country across all the indicators that I've mentioned. And I just want to give a huge shout out to the many people who helped make this possible. Executive Vice Provost Mary McKay was a big supporter of the Digital Intelligence and Innovation Accelerator, which is led by Dan Moranin and his team of Julie Baggio, Justin Park, and John Lee, who built this dashboard in conjunction with our team. So a huge thank you and shout out to them. They have an exhibitor booth right outside this auditorium, and they are kindly manning that booth so that they can walk you through how to use the dashboard. So I really encourage you to take advantage of that resource. Great, thank you so much. I look forward to the discussion.
All right, thank you so much, Todd. And we're going to give you a chance to catch your breath and engage our panelists in sharing some of their remarks. So in preparing for this meeting, and we let them have the data just a few days in advance so they could have a look. But what we asked them to do, and what I'm asking each of you to do, is to share with us in a few minutes, one or a couple of the most surprising findings from the People's Voice Survey from your perspective. Or a useful insight. What do you find a useful insight? And secondly, an implication, at least one implication of these findings for how we run, design, fund, organize health systems. So that's your charge, a surprising finding, and an implication for policy, please. And let's go in the order that we originally planned. So we'll start with Dr. Timothy McBride, followed by Dr. Galea, Ms. Schmidt, Dr. Nwangu, and we'll come back to you, Todd, for your reflections as well. So over to you, Professor McBride.
Thank you. This is on. Yeah, thank you, Margaret, and thank you, Todd, for this invitation and being on this great panel. So most surprising finding, I'm going to start by saying most of the findings were not surprising. So that's important because it's important from a validation perspective, because I was looking at the results relative to other findings I've seen in other surveys. But I'll go to the spirit of the question. Most surprising or kind of alarming, maybe I might say in response to the question, is the kind of, I'll put it in front of you as like a paradox. You might have been sitting there going like, what the heck is going on? 80% of the people really, we have the highest healthcare, people love their own personal healthcare, but they hate the damn system. So how the heck can that be? So I'm going to try to disentangle that paradox a bit. And I think I'm going to pose a sort of a answer to that. We have 18% of people said unmet need, 15% said financial strain. Alarmingly, or maybe we've seen this in other surveys too, but it's a really high number. 80% of the people said they want major reform, not major reform, that's not tweaking reform, not tweaking reform, major reform, higher in Missouri. So I think in part that's the answer. So, you know, people love their own doctor, but they don't like the system around them. And about, you know, 18 to 20% of people they know have struggle getting access to care and paying for care. And so that may be part of the paradox about how you can be really personally happy with yourself, but not like the system. Because I think we all kind of look around and go, yeah, that doesn't really work very well for the uninsured, for the homeless, and for those on Medicaid or whatever. And I'm going to say that, you know, I don't know if I'm an economist and if you all been hearing about this sort of K-shaped recovery. You know, it's another paradox. It's like the economy seems to be doing pretty well, but it's K-shaped. You know, it's doing pretty well for those at the top, not doing very well for those at the bottom, or actually going down. And I think that's also part of the explanation is, you know, when looking at these results, it's, you know, the system's working pretty well for most of us on the stage, but not working very well for the 15 to 20% that the survey's picking up, and particularly in mental health. And that's really striking. And just to get to your point about implications, we got to work on costs. We got to work on trust. We got to work on improving access to mental health, and we got to deal with, you know, their distrust. I mean, those numbers on government were, again, not surprising. We're in the middle of a government shutdown, but they really do not trust the government to solve this, or even some of our own leaders. So that's where I'd put my implications, costs, dealing with mental health, dealing with the trust issues, and fixing these problems. And in Missouri, I'll just very quickly say that it looks a little worse in Missouri on all those metrics, and in particularly for rural people, and I can come back to that later if we want, but I'll move on for now.
Thank you so much, Dr. McBride. Dean Galea.
Thank you. So first of all, thank you for having me, and congratulations to the Quest team. I think these data are really incredible. So maybe I'll answer the question, and actually I'm reflecting a lot of what Tim just said. The three observations that jump out at me, and I think the three implications. So number one is, and Tim, you used the word I actually had written down, which is paradox. I think there's an obvious paradox, which I mean, it's remarkable. 78% rate the system highly, and then 8 out of 10 think the system is in need of major reform. It's actually hard to think of another. It's hard to think of another good that you ever say that. Can you imagine saying 80% of us saying we really like our smartphone, but 80% of us saying our smartphone needs a total redesign? Like this almost doesn't make sense. So I think number one, there's a core paradox at the heart of this. Number two, it's very clear that we leave people behind. The poorest 20 to 40%, depending on how you cut your data, are getting much worse care than everybody else. And number three, there are particular areas that we neglect, and in particular here, you're looking at mental health. So I think those are the three observations that jump out at me. And then the question is, what are the implications for these three? I'll start each of them in sequence. Number one, the paradox to me suggests that our health conversation is actually quite fractured. I mean, the public conversation around health systems has been so dominated, for example, by access in this country for the past 20 years, which is a mismatch with where the problems really are. Actually, the vast majority of people do have access, and they feel like they have access when they need it. So we have a conversation that's not really reflecting the problems, which, when you think about it, then it's not a surprise that there are these paradoxes in the conversation. So number one is we need a much better, much more nuanced conversation about health systems. Number two, I think this country really struggles with, and it sort of shamefully struggles with, our willingness to leave people behind. I mean, we are leaving behind 20% to 40% of people on these systems. And you know, those are the people who, by the way, are also currently being left behind with things like government shutdown. I mean, you know, that we can, as a country, proceed with a government shutdown, which, let's face it, doesn't touch most of the people in a room like this most of the time. But it actually does touch the people who are being left behind in the survey. So I think the second implication is that we need to be much better as a country at making a moral and a practical case for not leaving people behind. And then the third part is we leave areas behind. Like, we're just not very good at being comprehensive in what we look at. And we're seeing it with mental health. I'm pretty sure, Todd, that if you present these data 5 years from now, you're going to find a lot of that mental health stuff has actually now gone better, because we're talking a lot more about mental health. And there are other areas that are then we're going to be leaving behind. Like we're not very good at being systematic about the areas that we're thinking about to really be comprehensive about making sure that we're covering all the areas that matter to people. So I thought this all emerged from your presentation really nicely. Number one is we need a much better conversation. Number two, we need to really focus on not leaving behind. And number three, we need to be much more systematic in how we deliver services. Thank you.
Thank you so much, Dean Galea. And Ms. Schmidt, please.
Hi. I am predominantly a Missouri public health practitioner, and so I think a lot about Missouri's role in the system and how the system in Missouri comes together to provide this type of care. A couple of the things that stuck out to me overall in this, I don't necessarily find it much of a paradox that we like our personal care and dislike the system. I think that when we think about the elements of trust and what it means to be trustworthy, there is a sense of what you need to have in terms of consistency and in terms of delivery. And so the people that you actually have direct contact with have the most ability to generate a sense of trustworthiness to you. And so, but when you think about like the broader system as a whole, your ability to influence insurance companies, your ability to influence hospital systems, your ability to influence public policy around these things is extremely limited, and you know that, and it certainly shows in our system-wide in terms of our ability to represent that. But people that you can speak to, who can deliver a service to you, are people that you are more inclined to trust. And so the more remote those systems are from you, or from your ability to influence them or talk to them or feel like you're heard by them, the more likely you are to be distrusting of that. And I think that plays out in a lot of different ways, and it was an element that showed up to me for this survey. We did a similar survey in Missouri earlier this year, but partly because of a lot of the national conversation about trusted public health specifically, and not broader healthcare, not broader health systems. But we asked Missourians about their trust in governmental public health and their local public health departments as a piece of that. They liked their local health departments significantly more than we initially expected that they did. So 60% of Missourians, 59% said that they had received a service from their local health department, which is 3.6 million people, like, by the way. 71% of them said that they trusted their local health department when they received a service from them. It was much higher than we expected that to be. 86% of them said that they felt like their local health departments gave them unbiased and accurate information. That was much better than we expected it to be. And so I think that proximity piece, and by the way, in comparison, they rated it higher than any other local government entities besides firefighters, because they're cooler than we are. But they trusted it more. They trusted their local entities more than they trusted the state. They trusted them 12 points higher than the CDC. To give them accurate and unbiased information. And so the locality and the proximity of service delivery to the population is what is inspiring trust. I thought that was similar to some of the things that were in the survey relative to your provider is great and the system is not. You have that access and that ability to generate that trust. I think the other thing in terms of our implications for policy relative to these findings, and I think a lot about Missouri's context in this in terms of how our numbers were worse in a wide variety of areas. We can't take our health systems out of the social context in which they operate in. So Missouri does not do well on a wide variety of social determinants of health. And so even if our healthcare delivery in some cases is better, or we're having some outcomes that are better, or we're activated, like we're still operating in an environment in which a large number of the other social determinants of health are not working for people, and that's impacting their health outcomes. We are in the highest quartile of states by population size. We're in the lowest quartile in almost every single health outcome that you could name. We can't take the system that we're operating in out of the social context that it's actually operating in, and that impacts health outcomes more than your doctor does.
Wonderful. Thank you so much, Spring. Dr. Nwangu, Nigeria has also done the People's Voice Survey, and actually more than once, and it's doing it continuously and independently at this point. Please tell us, first, you're here to reflect on the US findings, but also give us some experiences that you've had in Nigeria about how these data can make a difference.
Thanks. Hello, everyone. It's pretty exciting to be here most recently because we have 2025 People's Voice Survey for Nigeria, which hasn't yet been launched. So it's interesting for me to also get a perspective from the US version. And I think what stood out for me, repeating what everybody said, and it's good we have the same problem in the fact that people rated their own personal experience way higher than they rate the system. And we've been trying to understand why that is the case. And most of the reasons still boil down on the trust within the system. And for us in Nigeria, it's actually a very significant gap. We have people rating their last experience about 80% favorable, whereas for the system, we have them rating it about 35%. So for that, it kind of boils down to people's trust and perceptions of the system as a whole than their own individual experience. And one thing that we've also found in trying to look into this is that the low educated and the lower socioeconomic status, where the ones that were rating their experience is very high. And it kind of led us to try and understand what is the threshold for high quality of care for most people. And what we are kind of trying to understand is that it seems that the more educated someone is, there are higher levels of expectation of what a high quality service should be, which kind of makes sense, and that kind of helps us nuance the findings, nuance the findings, because it's one thing for us to come out and be shouting that 80% of people are happy with the quality of services that they receive versus what actually is the real quality of service. One of the things that stood out for me is in that in comparing with the US findings, that we have very low levels of preventative services for Nigeria versus the US, and it still kind of boils down to like the demographic transitions, where we still have people seeking curative services in Nigeria than preventive services. And it's also, I mean, one of the thing that was also resounding is the fact that unmet need, or people that didn't really access care when they needed it, was a lot higher for us. And it was very clear that the challenge for us in Nigeria is the cost of the care. It's interesting to find that in the US, you also have user experience as part of the reason why they didn't go. But the major thing for us is the cost of care. And in reflecting, how do we interpret these findings? I mean, for us in Nigeria, it's very clear that the major challenge that people have is cost of healthcare services. So trying to work on policies that influence health insurance, free services that we think are essential, that should be subsidized, are the things that the government is doing. And the final comment I want to make is, it is really resounding that surveys like this are part of the system, because people have to trust the system. People have to, and I know I might be jumping a gun, but I think one of the major challenges we have in pushing surveys like this is people saying things like people's perception is not a real indicator of service quality. But they miss the point that if people don't believe in the quality of service that they are receiving, they would not come back for that service. So you can do all your health system strengthening. If you don't assure people, or if you don't get people to believe that, they would not come back. So it's a work in progress, but I do think that findings like these are essential in trying to develop systems for people, irrespective of whether it's a lower income country or whether it's a high income country. Thank you.
Wonderful, Chike. And if I can ask you to add maybe just 30 seconds on how in Nigeria has the Ministry of Health used these data?
The current Minister of Health is a big fan of the People's Voice survey. I think he was part of the committee at the initial concept phase, and he has continued to maintain that. In fact, one of his mandates is that part of the things, he normally does like town hall meetings every year with people just to get the opinions. And the People's Voice survey, it's like a very factual evidence for him to see how people think about the system. So what he does like Dr. Margaret had said earlier, after the first round of survey that was done in 2023 by the Quest Network, Nigeria has gone ahead to do in 2024 and currently in 2025. So it is something that has come to stay with the Ministry of Health. And at the launch of, Nigeria has what we call the Joint Annual Review, which they now do every year at the end of the year. November is usually where all the commissioners of health from the different states in Nigeria come together to review how the system has performed. And the People's Voice Survey is a strong component of that discussion. I think the minister has been able to push forward the fact that people's sentiments are critical in designing healthcare systems that would function for them. So aside from engaging people and getting findings from the People's Voice Survey, engaging the policymakers on what people are thinking it also has been one of the key points that we have used these surveys for. And I think, for example, there is now a push for mandatory health insurance coverage, and that's one of the key findings from the survey, that cost is one of the major drivers of non-use of healthcare services. Thank you.
Thank you so much, Chike. All right, back to you, Todd. You know, I don't know anyone who's deeper into these data than you. I see Shalom and some others who might win that contest also. But I'm in particular interested, we haven't had time in this session to compare across the many countries, many other countries, except for briefly, that have also done the People's Voice Survey. Can you just highlight a few points of comparison that surprised you or have been particularly notable in your analysis?
Absolutely. I'm going to pick up on another potential paradox in the data, to borrow Dean Galea's framing. When we look across, so we have done the survey twice in 8 countries, in 2023 and in 2025. And when we look at confidence in the health system, that measure of people's personal health security I mentioned, it is stagnant or in decline in all of those countries since 2023, except the United States, where it increased. So we're the one country where in the last 2 years, people actually felt more health security. That said, like I said in my presentation, we see an increase in the proportion who think the health system's getting worse. So when I first saw that, I was really confused. So people feel like they can get good care today, but there's this pervasive fear about what's coming tomorrow. And so I've been thinking a lot about what is the health system's job in that? Does the health system just have a branding problem? You know, how much can the health system control? We can make people better, we can improve user experience, but at the end of the day, we know that so much of what people think about the health system, their satisfaction with the health system, is driven by things outside of the health system's purview. The discourse around the health system in the country, the politics, all the ecosystem that people operate in. So when I look at the discourse around healthcare in this country in recent months and years, I think it's actually no surprise that people are feeling pessimistic or afraid about what's happening with healthcare. And so that's sort of how I make sense of those 2 findings in this country. And it's one of the places in terms of the countries where we have 2 surveys where we see that. The other point I'll mention really quickly is about quality of people's own care. This is another instance where the US was the only country among those 8 where it increased about 4 percentage points from 2023 to 2025, people's ratings that their own care was good. In all the other countries, it declined. And that was particularly true in public systems. So globally, when we look at results from the survey, we are seeing concerns in terms of people's own quality and major red flags for public care. And as you could also see with people's concern about services for people with Medicaid in the United States. So those are some of the things that stick out to me when I look at the global comparison and some of the ways that I make sense of what we're seeing in terms of confidence in the US.
Great. Well, let me pick up on that a little bit and pose a question to our panelists. So one interesting thing, and I agree with you, the US seems to be doing pretty well on ratings of their certainly own care, nearby health system, and the public health system more generally. And it's also a country that is incredibly fragmented, doesn't have universal health coverage, right? We have a lot of people feeling health secure despite that, more so than in the United Kingdom, which has universal health coverage. So how is it that we would explain this? And I think, Todd, you've raised something, and Chike, you as well, about how these data reflect broader politics, and that's certainly true, and partisanship and issues such as this. But I guess I want to ask a more basic question, which is, should we take what the people say, as face value? Do we somehow, discount some of these opinions? And if so, what is the value of something like the People's Voice Survey? If not, if these opinions matter, are they indicative of something else? For instance, is there a resilience in a very fragmented health system that we're seeing post-COVID in this country that hasn't emerged in some of the other countries, right? Is that a possible explanation? So I just want to put some of the thorniest questions that we have of the People's Voice survey. Do we trust these people's opinions? What is the implication of having some of these great ratings at this point, at least for some aspects of healthcare? Should we take them with a grain of salt? So yeah, please just indicate if you'd like to take this on. Tim, over to you.
Yeah, I think on your latter question, we do need to take the citizens' voice is important, because I think when we talk to policymakers, leaders, look, be honest about who's talking to them. It's the providers, it's the systems leaders, it's businesses leaders, university leaders like ourselves. And so the people, the citizens are not always in the room. And, you know, some of you know that I chaired the Mo Health Net Oversight Committee for 9 years. And when I was put on that committee, I was put in the consumers chair. There was a chair of that 21-person committee that had the title consumers chair. And I thought, well, that's interesting. I'm going to take that really seriously. So I'm going to say it's a privilege to take that role, and it's a responsibility. I think we have a privilege in where we sit and a responsibility to be the voice of the people. I think they need to be given the space to have that voice, and a survey like this can be that, but we need to amplify that, because I think sometimes we miss things because we look at it through our own narrow lens of the university or the hospital or whatever. So I think it's extremely important.
Okay, well, great. Thanks, Tim. Spring, you're next.
Yeah, I also fully value the citizens' opinion, and I do think it matters. And I think we always have to ask, and we always have to take it seriously. But I'm not sort of removed from the idea that I don't also want to completely reform the system and in some ways completely redo whole parts of it, because there are things. And I don't think that it doesn't feel disconnected from my own sense of the system's fragility, or the parts of the system that I'm worried about whether or not they'll have enough funding to sort of continue to do their part. And even if they're doing it well now, like for the people that they're serving, I know that there's people they're not serving. I know that there's even parts for the people that we are serving that some of it is so fractured that I wouldn't also tear it down and completely rebuild it. And so I can hold both sort of pieces of that. I know that we are meeting some needs. I know that we're doing some things extremely well. I know that there are parts of that system that are working just fine, and there are whole other structures that I would gut.
Okay, right. So you're asking for nuance and maybe a little gutting. All right, Chike, over to you, please.
It's a great question, because I think that's one of the biggest challenges that we have in Nigeria. What do we do with these findings, and how much attention should we pay to these findings? And that's the conversation that always comes out when the result is out. And it's a very dicey thing for you to say, oh, you should take it with a pinch of salt, because it basically dumbs down the findings. So we stay by what we found, because these are what people say their opinions are. Yes, we might put some nuances in trying to explain some of the findings, or to give you some guidance in how to interpret that. But essentially, they are critical findings and how people feel the system responds to them in their need. And I'm going to just throw back to the first panel where we said, what is the goal of a health system? It is to solve the problem of the people. And the people are saying that this is their challenge. Whether we believe it or not, or whether we feel this is factual or not, is something we need to dive into. At the very least, try to explain why it happens, or why people think this way, and then see whether we can do something about that. For Nigeria, for example, most of the focus of the country going forward now is going to be on health insurance, because one of the key findings from the 2025 survey is that people say that the cost of healthcare is challenging. We have about 40% of people that say they have to borrow money to be able to afford healthcare. So whether we think that is an exaggeration or not, it is a problem that exists, and that we should do something about that.
Okay, let me direct a question to Dean Galea, because he has the enviable task of kind of reconceiving what public health looks like at this moment post-COVID. And I'm thinking about the line that came up from one of you. Well, maybe it's just a PR problem. Maybe really these issues of trust and confidence and quality ratings, we just have a PR problem. We haven't explained our mission, whether it's public health or health systems, well enough to the population. Is this a PR problem?
Everything in life is a PR problem. You know, just take a step back for a second. I don't think we can forget, like, health is probably one of the only, like, truly universal human values, right? You know, we can discuss what values animate people across the world. We can talk about freedom of expression, freedom of assembly. We can argue, we can argue about those. Different countries have very different perceptions about them. But there is not a single country where all people would prefer to live longer, healthier lives. It's actually very straightforward. So, and in this country, we put our money where our mouth is on this. I mean, 18% of GDP is spent on health, and it is the largest single sector. And at the same time, as we're doing that, we have an aging population. I mean, it's not a stretch to say that all these challenges we have today are going to become bigger challenges by 2030, 2050, just by sheer virtue of the greater pressures on the health system. So, coming back to the question that you asked me, I don't think it is a PR problem. I think it's actually a real problem that we, as citizens of the world, are trying to figure out how best to address something that is meaningful to all of us, that is really a core human value, and frankly, something that nobody really quite has right. I mean, systems like Canada and the UK that for decades were held up, and particularly by sort of activists in this country saying, well, look, we can be like Canada, we can be like the UK. Well, Canada and the UK are not doing very well in their health systems right now. Their levels of dissatisfaction are much higher than they are in this country. And that is in no way trying to say the US system is better than Canada and the UK, but simply to say there's a lot of turmoil in this space right now. But I think the turmoil is genuine turmoil. It is a value that is dear to all of us, number one. It is a value that we're spending a lot of money on, number two. It is a value that we feel like we're not quite able to put our arms around. And you know, when I think about that, and I think about this meeting, just to bring it here for a second, I actually think about how complicated it is to develop health systems that truly are quality health systems, that are affordable for societies to carry out, that meet the needs of all people, and how important the science to do that is. So absolutely, I think we need a People's Voice survey. We need to fold in how people think, but we can't make the mistake of thinking that that by itself is going to be enough, because actually we need both the evidence and then we need to do the really hard work of putting this in play. And I think when I reflect more and more on the survey, which, as Margaret said, we were fortunate to get it a little bit ahead of time, so I had some time to reflect on it. There's some really interesting things in there, and a lot of things are hard to wrap your brain around. And I think the reason hard to wrap your brain around is because we as a society are having a hard time wrapping our brain around them. I think the survey reflects that.
Wonderful. So when our children were little, we used to always look for signs of spring. Let's go out and look for signs of spring. So we actually have spring on the panel. We don't even have to look that hard. But what I would love to do is, in a rapid fire round here, go down this panel, please. And I would like you to identify, well, one sign of spring in these, one sign of optimism, one signal that we should be celebrating, maybe organizing our thinking around, right, as we think about policy and structural change. So, Chike, can I start with you at the very end there, please?
Reflecting on the findings, for me, one good sign is that preventative healthcare uptake is really high. I think that's the first step in getting people to utilize the healthcare system before, not just when they need the healthcare system. I mean, and then the downside is the fact that people still are not able to afford care if they don't, I mean, just because
No downsides, I'm
okay.
sorry. Chike, no.
All right, so I'll focus on the fact that the uptake for preventive services is high, and the fact that the US has a very high contact.
That's what I'm talking about right there. So we want to avoid that reflexive academic pessimism, because the rest of the meeting will be devoted to that. So over to you, Tim, please.
So we're supposed to, sorry, I got mixed
I know, see how hard it is for him to comprehend?
I'm
McBride,
very hopeful
a bright spot.
Sorry about that. I'm hopeful that most people are very happy with the healthcare they receive themselves, and that's good, but I'll...
No but.
No but.
Thank you so much. Over to you, Spring.
I think I'm continually seeing a bright spot in how many people are working together to talk about this. We're reaching across systems, we're reaching across organizations, we're reaching across countries, we're reaching across, like we're including people's voice. That always matters. But the systems, I think, have learned more about their interreliability on each other. And so part of managing the fragility that we feel is pulling together. And I think more people are having conversations about that, and that feels like a bright spot.
Thank you, Sandro.
I think spring follows winter. I think COVID was the winter of our discontent. One in five people only think that we handled COVID right. That's really terrible if you think about it. The sign of spring, though, is that we're finally, and I think it's taken us a long time, beginning to take that seriously, and we're beginning to ask the difficult questions about what happened in COVID, why did that happen, what does it mean, what does it mean for how we think about health, what does it mean for how we constitute the entire ecosystem that generates health, and I think that is immensely hopeful.
And Todd.
I'm going to take this opportunity to throw a couple more data points at you. I can't help myself, sorry. We've been talking about how people approve of their own care in the US over and over. And I can tell you some of the areas that improved in the US, which give me hope for the health system and how hard health workers work to make care good for people. Time spent with a provider improved. Respect of care improved. Courtesy of the staff, the non-provider staff at the facilities improved. So when we kind of look under the hood of what's happening and why people give those good ratings of their own care, there's many bright spots. And that to me is a sign of spring.
Wonderful. Well, I would not want to summarize everything that's been said here today, especially not all of the data, but you can all please dive into the data over lunch and the break. I do want to make just a couple of closing remarks. You know, one word that maybe was repeated more than any other is paradox, right? And I think there's just more than one type of paradox in this work, in this survey, but this huge divide between the private realm and the public realm, how we rate things that we ourselves seek and find and get versus what is available to the public. And those of us who study behavior or behavioral economists will certainly tell us this is very common, that people value their own private goods once they've acquired more so than maybe others. But I think that it behooves us, academics, researchers, people who think for a living, to explain those differences, because actually at quick face value, it does seem contradictory. So again, the paradox means more work for us, but it doesn't mean ignore the data, right? And I think the signals of discontent with the system that we're picking up from this paradoxical set of findings are leading indicators for what's coming, right? Just like the aging of the population is a leading indicator for the strain we will see in the health system. Similarly, the levels of desire for change are leading indicators for what people are going to put up with. I think it's absolutely crucial. And maybe just to end with my own sign of spring in these data, you know, I think a lot about confidence and trust. And I think about the fact that as per the survey, the battle for the public's support and engagement and trust around COVID, we seem to have lost that battle, which is an incredible thing given the scientific advances and really the huge life savings that were possible during that time. But I think that for me, the sign of spring here is, I don't think we've lost the war. I think hearing Spring talk about how people value their actual public health agency in their community tells me that public health is not a dirty word in Missouri, right? And it tells me that there are those opportunities to rebuild and reframe the kind of work we do in health systems and public health and more broadly for the benefit and for the task that Dean Galea outlined, the extremely wicked problem that we face, and problem not just of technical expertise and complexity, but a problem of values, a challenge of values, and what it is we want to put above other values. How do we balance all of those priorities? So with that, please join me in thanking our incredible panel and Todd Lewis and company for the amazing. And I would actually like, before we release you to lunch, can we just have the team that's been the PVS team, please stand up. You know who you are. These folks have been working day and night to analyze incredibly complex data. We're so proud of you, and thank you so much for this work. And